Hi everyone, I am Dr. Ramesh from Cessna Lifeline Veterinary Hospital. Can I get one new one of this? Today we have a indie dog who has got some corneal lesion, and to me looks like it is a corneal degeneration or it's a Bullous Keratopathy. Some area looks like healing, but we have this is there in both the eyes, and this is almost the non-healing area for last 2 to 3 months as per owner, and this is causing lots of this fibrous tissue formation. Blood vessels are going inside, but some area, can you see the bulla is here. This corneal stroma is very just like liquefying, and that's not allowing it to heal completely. So what we are doing is we are doing a debridement keratoplasty, where we are removing one full thickness, like a half thickness layer of the cornea, and we are following with the third eyelid flap. In these cases, some recommendation you can put a conjunctival flap, but in that there will be more of scar tissue, and being the center area is affected, we want to try without that. So I'm just giving an incision here, and we are going to remove all this unhealthy tissue. I'm using my loops. I'm not doing this surgery under microscope. So once we make our incision, we need to just start separating this, and we need to just make sure that we get a nice plane, and then just we follow this plane. And later on, in case if I need to increase, because there are lots of blood supply already there, so that there will be some bleeding, and you can see this, my knife is going under this, it's just undermining. I'm just going under this, and you can see this area. Then I'm just going out where, and I'm holding this cornea. Earbuds for them. Can you get a few more earbuds? Can I get little saline? No, sorry, the adrenaline also. So we can see that whole thickness, which is the abnormal thickness cornea, I am removing slowly. That's all. There one big blood vessel is there, which I am going to cut at the end, because it's going to bleed. Keep putting saline to make it more visible. I need to try to stay in the same plane. I should not dip inside. Saline. Keep putting saline. So this is the whole bulla area I have removed completely. You can see the big chunk of the tissue, and then remaining some unhealthy tissue still there. This tissue is having high blood supply, so I am not removing it too much. You can see now the cornea has become more transparent, and this, in case these bleedings are there constantly, we try to avoid anything applying on that. Just we do a pressure. So with these buds we can do the pressure for 2 minutes, and usually normally after 2 minutes, once we remove these this bleeding will stop. Sometimes we put adrenaline just to make sure that you put the adrenaline. Few drops of adrenaline you can put over the, yes. And now we are going to put a flap over this area. Sometime, in case if this bleeding is not stopping, I can do a pinpoint cautery, where we have a pin, like it's a ball cautery. We just make the ball of the cautery warm, and then just we attach to that area where the bleeding is happening. Can you keep ready that also, in case required? We'll do that. Looking good, no? So it's still bleeding, and even we can leave it bleeding also. Little bit extra bleeding is happening, we can leave it for some time. And being we are putting third eyelid, bleeding will, with the third eyelid pressure, bleeding will stop in some time. So it's not mandatory. I try to avoid using cautery near the eye cornea area, because bring lots of inflammation, but that's fine. If you have to leave it without that also unattended, we can do that. You can just hold it. In the meantime, I just keep pressure. We are going to put a third eyelid flap, and for that I use these this is SV set. And what I do is, I don't use SV set completely, I just cut it from the center to make a cushioning effect to the suture. So one part I opened and I have removed, I have made it like this, open area. I don't use the pipe as such, because in that there is debris can accumulate and you can't remove for next 10 to 14 days till this is there. So I try to keep it open. I try to use like this, and this is from SV set only. If the bigger dog is there, you can use your IV set to make these. Another one we have made. So we are going to put 2 sutures. So now the bleeding almost stopped. We'll just do a nice once flush. And then we are going to start making our third eyelid flap. So for third eyelid,
one possible case for immunity is L2 cutoff. So took sample into lab for kids and anything.
3 o'clock we can do CT. So how to decide what direction we need to put this flap? We just hold the third eyelid and we see which direction is coming easily, like this. So my aim is to put one suture here and one suture here. And so we have made this structure, these small cushioning pillows, and then I'm just taking a bite from in to out of this. I'm putting the down one first, so I'm just taking a bite from this area. I need to hold my third eyelid, and you can see the cartilage. I am going to take half bite through the cartilage also. So if cartilage get involved, the tearing possibilities are less. and to avoid the tearing we can avoid even making it more tight also. So one we have put here. Now we are going to take a bite through this, and we are not going to tighten it now. We are just going to put a artery forceps, because to put another suture we need some space and we need the visualization. So another area, again I am taking a bite from here. You can just make this, can you see the third eyelid flap which I already put? I am just involving some part of the cartilage and the margin of the third eyelid, and I am going back inside. And another bite through this structure. So I am not putting too much pressure, I am just opposing it. If you sometimes put more pressure on these sutures, there will be tearing of the either skin or the third eyelid. So don't try to pull it too much. You can see this is nicely sitting and it's giving protection to the area where we have removed the bulla. And because already there is lots of blood supply is there, it's going to heal quite fast. We don't have to wait for the blood supply to come and all. And 2 weeks later we are planning to remove these sutures and see whether it's fine or not. During this period we are putting the drops through this area. We will put the drops. We are going to put 1 or 2 times dilator, the tropicamide, and one antibiotic we are putting, and these area will keep applying, cleaning with the saline and keep applying ointment in case required. And we will, that's all. Post-operative care, probably 3 days of painkiller we are going to start, and that's all. Thank you.